preventable. In today's Focus on Your Health, Teresa Snow tells us about a new targeted treatment option that has doctors and patients optimistic.
Focus on Your Health is sponsored by MU Healthcare.
We usually associate lung cancer with smoking, but some people who develop lung cancer don't have any clear risk factors. And while treatment can be difficult, there is hope.
Good dog, up.
Kathy Bennett's support network includes her dog, Jack. She's had to rely on him a little extra since learning her cough and lingering cold were actually stage 4 lung cancer.
I've never smoked. I've never had any problem with my lungs. I've never had asthma. And of all the things I thought, all the health problems I thought I might have had, lung cancer never entered my mind.
While tobacco use is the #1 risk factor, up to 20% of people who die from lung cancer in the U.S. each year have never smoked. Kathy tried radiation, chemotherapy, and immunotherapy, but she was running out of options when these treatments stopped working. Until the multidisciplinary team of specialists at Ellis Fischel Cancer Center found a genetic abnormality.
Kathleen had this ALK-mutated lung cancer, and when you have that, there are these new what are called tyrosine kinase inhibitors, drugs that specifically target this genetic abnormality.
Dr. Michael Trendle, a medical oncologist, says this type of targeted medication is the future of cancer treatment.
As we get more and more knowledge about cancers, more and more almost everybody's tumor is being tested for these genetic abnormalities, because if the cancer has this particular genetic abnormality, there may be a medication that can target that specifically.
So far, it's worked, and Kathy has been able to cook, shop, and travel. The drug will likely only keep working for a couple of years, but Dr. Trendle says there are others they can try, and Kathy isn't giving up hope.
We had another friend who was diagnosed with cancer, and she gave her chickens away immediately. And so the joke with my circle is, we're not getting rid of the chickens yet.
Savoring the simple joys of everyday life. Joining me now is Dr. Jussuf Kaifi, a cardiothoracic surgeon here at MU Healthcare. Now, as a non-smoker, Kathy is probably not typical of many of the patients you see. Give me a profile of the lung cancer patients you're treating.
Since we have one of the highest smoking rates in central Missouri and the whole nation, most of our patients with lung cancer are long-term smokers.
And these long-term smokers are smoking packs a pack a day, more?
Yes, they usually smoke 1 to 2 packs a day, and most of them unfortunately have started very early in their life, so they're pretty heavy smokers in the state.
And these are the same folks that you want to find for screenings to try to catch it early. Tell me about those screenings.
That's correct. We have a screening program here at MU Healthcare where we screen patients that have smoked 30 pack years, which means they have smoked 1 pack a day for 30 years at least. And once they are past 55 years old, an insurance will pay a low-dose CT scan, which is a CAT scan that doesn't have that much radiation exposure, and it identifies lung cancer early.
So you do the screenings and the treatment. What's unique about being at an academic health center and treating lung cancer patients?
So we can treat them right away with robotically assisted surgeries, and actually the cure rates are pretty high. If they can't undergo surgery, we can do targeted radiations as well, like radiosurgery, which we offer here at MU Healthcare.
Great. Thank you very much, Dr. Jussuf Kaifi. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Health.